Hey there, it's Dr. Jim, and I have a question for you. Are you suffering from seasonal affective disorder or SAD? Lots of people do. It's that time of year where the days are short, the nights are longer, and we are living in darker conditions. It's my least favorite part. Can't wait for spring. Seasonal affective disorder is a form of a recurring major depressive disorder that has seasonal patterns that begin in the fall and extend through the winter months and sometimes a little bit more into the spring. To be diagnosed, though, an individual would have to have experienced specific symptoms for at least 2 years in a row and have more seasons with depression than not over one's lifetime. So if you're just sad and moody during a winter one time and you don't experience it for years, it probably is not seasonal affective disorder. Symptoms include a sad mood and low energy. People with SAD report they often feel like crying, they're irritable, they sleep more, but animals do in the winter. I mean, we hibernate, so we're not that far from the animal kingdom ourselves. And people report having difficulty concentrating. Other symptoms include withdrawal from social activities, decreased activity levels in general, a craving for sugar and carbohydrates, and weight gain. Of course, if we're munching on those carbs and sugars, we're going to gain some weight. Symptom severity, though, ranges from mild to severe, and sometimes even severe enough or profound enough to induce suicidal thinking. So SAD occurs 4 times more in women than in men, and the age of onset is between 18 to 30 years of age. People living in northern regions, furthest from the equator, have higher rates of the disorder. Well, as I age and as I retire, I'm moving closer to the equator. It has been found that people with SAD have difficulty regulating the neurotransmitter serotonin, which balances mood and may overproduce melatonin, which responds to darkness and sleepiness. Luckily, there are many ways to treat seasonal affective disorder. Vitamin D is one of the most simple things that you could take. It helps because most people with SAD have been shown to have low levels of vitamin D. Light therapy is another option and can help to reduce overproduction of melatonin, which makes you tired and drowsy. Some may choose to find a good therapist or a counselor. Another option is perhaps to start an antidepressant to help serotonin do its job and to improve overall mood and well-being. If you think you are suffering from seasonal affective disorder, talk to your physician or to a healthcare professional. Start preventive measures, though, like increasing vitamin D months before the fall begins. Get regular exercise and eat gut, brain, and heart-healthy foods. Even if you do experience SAD, you may be able to diminish the symptoms and improve your quality of life. There you have it. Seasonal affective disorder. I'm Dr. Jim Collins. Keep coming back for more.